Ever wondered why some people can't resist the pull of sleep, no matter how hard they try? This leads us into the world of sleep disorders, specifically hypersomnia and narcolepsy. Derived from the Greek words hyper, meaning over, and somnus, meaning sleep, hypersomnia translates to oversleeping. However, this is beyond hitting the snooze button too many times. Imagine this. After a complete 8 hours of sleep, you find yourself battling an irresistible urge to sleep through the day. It's not just fatigue, it's excessive sleepiness impacting your daily life. On the other hand, there's narcolepsy, an equally fascinating sleep disorder. Picture being amidst an important presentation or a hearty laugh with friends when suddenly, without warning, you fall asleep. This isn't due to exhaustion or boredom, but a condition causing sudden and uncontrollable bouts of sleep. These may seem like scenarios from a science fiction novel, but they are very real, affecting millions globally. The World Health Organization estimates up to 10% of the global population might struggle with a sleep disorder. Hypersomnia and narcolepsy represent a significant chunk of these sleep-related issues. Now, if you've questioned why you're always sleepy despite enough rest, or if you know someone who can't resist daytime sleep, you're in the right place. We're about to delve deeper into the science behind these intriguing sleep disorders, exploring their causes, the realistic impact of living with them, and potential solutions. Get ready as we unravel the mysteries of hypersomnia and narcolepsy. So, what exactly makes someone sleep too much? Let's dive into the intriguing world of hypersomnia, a condition where people find themselves excessively sleepy throughout the day or sleep longer than the typical 8 to 9 hours a night. First, let's look at the brain, our command center. It's a complex organ that controls not just our thoughts and movements, but also our sleep. For a healthy sleep cycle, the brain switches between REM, rapid eye movement, and non-REM stages. However, in hypersomnia, this balance gets disrupted, leading to excessive sleepiness or prolonged sleep durations. Now imagine a set of switches in your brain, controlling when you sleep and when you wake up. In hypersomnia, these switches seem to get a bit, sticky. They don't function as they should, causing you to feel tired even after a full night's sleep. Scientists believe that the hypothalamus, the part of the brain responsible for sleep, might be the culprit. But our brains aren't working alone in this. Genetics also play a significant role. Research has found that hypersomnia often runs in families. If your parents or siblings have it, your chances of having it are higher. Yet, the exact genes responsible are still a mystery to science. However, it's not just about what's inside us. External factors like other medical conditions, medications, or even lifestyle habits can contribute to hypersomnia. For instance, depression, anxiety, and certain neurological disorders are often linked with excessive sleep. And then there's the role of our internal body clock, or circadian rhythm. This natural timekeeper regulates when we feel sleepy and when we feel alert. In hypersomnia, this rhythm may be out of sync, causing a constant feeling of sleepiness. Isn't it fascinating how our bodies can sometimes work in ways we don't fully understand? But hang on, we're just getting started. The next chapter in our journey will take us into the reality of living with narcolepsy, another intriguing sleep disorder. Stay tuned, folks. Imagine falling asleep while talking, eating, or even walking. Sounds unbelievable, right? Yet, this is the reality for those living with narcolepsy, a neurological disorder that affects the brain's ability to control sleep-wake cycles. Living with narcolepsy is like being in a constant battle with sleep, a battle that can strike at any moment without warning. Imagine trying to stay awake during a meeting, a meal, or a conversation, but your eyelids keep getting heavier. Your mind keeps drifting, and no matter how hard you fight it, sleep eventually wins. But narcolepsy is not just about excessive sleepiness. Many people with narcolepsy experience cataplexy, a sudden loss of muscle tone that can lead to weakness and loss of voluntary muscle control. This can manifest as slurred speech, drooping eyelids, or in severe cases, total body collapse. Narcolepsy can also ruin one's social life. The unpredictability of sleep attacks can make it difficult to maintain relationships, hold a job, or even perform daily tasks. It can lead to feelings of isolation, depression, and anxiety. But it's not all doom and gloom. The reality of living with narcolepsy is also a story of resilience, strength, and the human spirit's ability to adapt. With the right treatment and support, people with narcolepsy can lead fulfilling lives. Recent medical publications suggest that a combination of medication, lifestyle changes, and counseling can help manage the symptoms of narcolepsy. It's about finding a balance, a rhythm to dance to amidst the unpredictable waves of sleep and wakefulness. Living with narcolepsy is not a walk in the park, but the good news is it's manageable. And as we peel back the layers of this complex condition in the next scene, we'll explore solutions and strategies to help those living with narcolepsy navigate their daily lives. So, are hypersomnia and narcolepsy life sentences? Absolutely not. Now that we've delved into the complexities of these sleep disorders, let's explore the solutions. First, let's consider lifestyle changes. These can be as simple, yet profound, as maintaining a regular sleep schedule and creating a sleep-friendly environment. This means going to bed and waking up at the same time every day, ensuring your room is dark, quiet, and cool, and avoiding screens before bedtime. Regular exercise and a balanced diet also play a crucial role in managing these disorders. It's like being a detective of your own health, finding the patterns that work best for your body. Next, we have medication. Now, this isn't about popping a pill and expecting miracles. It's about working closely with your healthcare provider to find the right medication and dosage that can help manage your symptoms. For hypersomnia, stimulants or wakefulness-promoting drugs might be prescribed. For narcolepsy, a combination of stimulants, antidepressants, and other medications that regulate sleep-wake cycles could be the key. But let's not forget therapy. Cognitive behavioral therapy, or CBT for short, is a type of psychotherapy that can help you cope with the emotional effects of these disorders. It's like having a conversation with your mind, teaching it new ways to respond to sleepiness and fatigue. And then there's the emerging field of alternative treatments. From acupuncture to yoga, these practices are gaining popularity for their potential to enhance sleep quality and overall well-being. It's like giving your body a much-needed vacation, a break from the hustle and bustle of life. Remember, every person is unique, and what works for one might not work for another. It's about finding the right combination of treatments that suit your individual needs and lifestyle. While there's no magic pill to cure hypersomnia or narcolepsy, there are ways to control them and live a normal life. It's a journey, but with patience, perseverance, and the right approach, you can navigate these sleep disorders and reclaim your nights and days. So, we've journeyed through the world of sleep disorders, specifically hypersomnia and narcolepsy. But what's next? We've peeled back the layers of the enigma that is sleep, demystifying the science behind hypersomnia and shedding light on the realities of living with narcolepsy. Now it's time to turn this knowledge into power. If you or someone you know is grappling with excessive sleepiness, unrefreshing sleep, or sudden bouts of sleep, it's time to step forward. Seek professional help. Don't be shackled by the chains of these sleep disorders. Reach out to medical professionals. Learn about the latest treatments. Engage with support groups. You're not alone in this fight. The key isn't merely about sleeping more, but sleeping better. It's about quality, not quantity. It's about living life, not just sleepwalking through it. Don't let sleep disorders steal your dreams. Seek help, manage your symptoms, and reclaim your life.